In relation with mental issues or mental illness, uh, I would say that you could find a different value and a different perspective according to the education, the level of education that the family or the person that is having the condition might have. So it's kind of relative, you know. It depends on the level of education that they might have, and also the economical status the of the family. Definitely, you know, if the person or the family has the resources, they can access the doctors and the service providers that they might need, the therapists. But in some cases, you know, people who, I think that basically the problem is that people who doesn't have the means to get treated, they go without a diagnosis. They don't even know, they don't have the means to go to a good psychiatrist and have the diagnosis. So many people go untreated, especially in a class that might not have, like I said, the resources, financial resources to access the services. Unfortunately, many people who has mental illness in a third world country like mine is just ignored and put aside and treated like as a taboo. Is a struggle, a day by day struggle. Our class is divided in the poor, the people who have no access to health care, and the rich. We lack the class, the middle class. We no longer have a middle class. I think that if the kids have mental illnesses, like I said priorly, they tend not to be. Their tendency is not to be diagnosed on time, and it's very frustrating for the kids who cannot explain their own behavior or control it, and the parents get frustrated also because they don't understand. There is no awareness, enough awareness of mental illness. In many cases, people tend to believe also that it's something related to the supernatural or the paranormal. Paranormal, they tend to believe that probably a person who hears voices is hearing voices from beyond, or from according to their beliefs, you know. They might think that they hear voices that uh, probably spirits are talking to them, and that is very common in our country. I went through my whole life without being diagnosed. I had the sense when I had the illness, and I didn't know I had it. I believed that I was a person that could do better, but didn't try hard enough. I didn't have an understanding of the illness at all. And it wasn't until I came to the States that I was diagnosed, and by then I was 30 years old. By not understanding the illness, thought of myself being someone that couldn't control myself, and that I could control myself, but I didn't do it because I was just not uh, making the right effort. I couldn't really be what they expected me to be. I remember when I was in high school and I would get depressed for days, my mother used to think that I was just lazy, and that I didn't like school. I just couldn't go on and do the things that I had to do. I have really a lot of respect for the system here. I know that it's not perfect. I know that much, but uh, there is a lot of awareness, and people is treated with respect. I believe that one of the things that really is the people here is mindful of is confidentiality, and people with mental issues are well taken care of here, if especially if you compare the situation with, like I said, uh, third world countries where I'm from, where I'm coming from. I'll tell you something that I think is being done really good. Is the peer movement is being an excellent way to approach people because of the sharing of the condition. You know, when the consumer is there to work for other consumers, they can relate to it, and people open up a lot more. Being that in my culture, mental illness is treated like a taboo, uh, it's not easy to approach someone and suggest even that they get treated or that they go for an evaluation. But when you know the culture, it's really much easier because you know ways in which you can relate to that person, and you can share with them your own uh, story of mental illness, and that definitely, uh, bring them in and help them understand that they are not alone. That is just like another illness. It's like having diabetes.